Hi, everyone. This is Dina Nebley from New Jersey Family Magazine. Thrilled today to be joined by Dr. Winokur, who is going to talk to us today about why it's so important to keep up with our pediatric dental appointments. Dr. Winokur is a board-certified dentist with Dentistry for Children, which has 5 practices, right? 5 offices?
5 offices.
And a couple new, one in orthodontics now, and has been around for 40 years. Generations of patients. So I'd love to start by hearing a little bit about your practice.
Sure. So my dad actually started the practice 40 years ago in Toms River. He's also a pediatric dentist. He started the practices with my mom, who is a general dentist. So he's been working in Ocean County for years. And he's really gone to love the population there, and a lot of the families there have known him and seen him for multiple generations. So I came in a few years ago, and since then we have been working to expand our practices. We're now in Lakewood, Toms River, Jackson, Neptune, and then we have a new office in Howell.
That's really exciting that you're growing. And I think one of the big reasons we wanted to chat with you today is because as we're dealing with the pandemic, and a lot of parents have been delaying things that seem not essential, right? They're only going to the most essential appointments.
Right.
And I think we know how important it is to not delay those routine checkups. And so I thought we could start with just what your thoughts are on that, and also what your practice is doing in terms of safety protocols and how you've reinvented the patient experience during COVID.
Absolutely. This is a very strange and crazy time for everybody. And, our practices focus on pediatric dental health, but also the special needs population. And we see special needs patients up to any age. And especially in children and special needs, oral health and oral care is extremely important. And I know a lot of people are very nervous to go out and go to the dentist during this time, but it's essential. Dental cavities are the most prevalent disease in children. So it's very, very important that they stay up on their oral health and their hygiene and all of their regular appointments to make sure that these kids aren't in any pain, so we can treat what's necessary before it gets to be a very big problem. We've changed a couple things in our practice since the whole COVID epidemic. We're very lucky because our practices were really up on infection control prior to the pandemic. But we are doing quite a few things to keep all of our patients and our staff and my team healthy. As far as my staff and my team is concerned, every day we wear N95 masks for any procedure. Before we even get started for the day, we have a health screening. Everybody gets their temperature taken, and we review all of this stuff as a team prior to the appointments for the day. Every patient that comes in gets a questionnaire about where they've been, if they've experienced any health concerns, if anybody in their family or whoever's living with them have had any issues. And then once they come in for the visit, we take their temperature as well. One really big thing that we're doing in our office is we're really trying to reduce the volume of people in the office at a time. So where it used to be that a patient may come with both of their parents, a grandparent, other kids, right now we're asking that the patient just come with one caregiver or one other person, just to reduce the amount of people in the office. So everybody that comes in, they wear a mask, they sanitize their hands, and their temperature is checked upon entering the building. Aside from that, we put in air filtration systems around the practice just to really help reduce the aerosols, because everybody's worried about that with dental procedures. And we make sure we thoroughly clean the rooms and let everything settle prior to bringing in the next patient.
It's a lot of work that goes into it, for sure.
It is.
And I'm sure it extends your day. Your operating day might be shorter, but your prep and post-prep must be a lot longer and more detailed, clearly.
It is, but the safety of my patients and my team is the most important. So if that means reducing the number of people and just taking a little extra time or, wearing some extra protective equipment, that's what we're going to do.
Yeah, that's really reassuring. You mentioned about dental decay, and I know this is something I've read a lot about, it being like the leading, pediatric disease in the United States, which you don't think of it as a disease as a parent,
Right.
you think of that as a disease, but it turns out it is, and it's really common, especially by the time your child gets to kindergarten, they experience some sort of dental decay. Can you talk about that and what parents need to know about that?
Absolutely. A lot of people don't even think about cavities as a disease or as an infection. And that's what we're trying to get people to understand. It's very interesting to learn that dental decay is more common than asthma, which is one of the more common childhood ailments. So we really have to get on top of these things because the bacteria from cavities can spread elsewhere in the body. And aside from that, can cause pain, can cause infection, can cause kids to miss school and have malnutrition due to the pain that they're experiencing. So what parents really need to understand is that we do recommend that their child come to the dentist by age 1. The older thinking is that a child comes to the dentist by age 3. But we're finding is by that time it's way too late. If we see them by age 1 or 6 months after their first tooth, it really reduces the caries rate among these children. Aside from that, brushing twice a day, flossing young children, and really reducing the amount of juice and sticky snacks that children have is essential.
And what about taking care of infant teeth and baby teeth? I always found that really challenging and never felt like I was doing it correctly when my kids were babies. What do you suggest parents do in terms of daily care when they're babies and their teeth are just gums and just barely coming in?
Right, it's not easy. But what we found is that the earlier you start brushing a child's teeth, the more compliant they are. So when they're really young, they're moving around, they're not easy to control. But if you lay them down and put their head in your lap, it's an easy position to be able to brush their teeth. With young children and babies, you do want to use a tiny bit of fluoridated toothpaste because the fluoride is very helpful when the teeth are erupting into the mouth. So just a tiny little smear is very important, and it doesn't have to be that long when they're young. You just want to make sure you get all the soft stuff off the teeth, and really just to desensitize them to the toothbrushing experience.
And speaking of baby teeth, how important are they in terms of the role they play in overall oral health? I know at some point all those baby teeth are going to go away and they're going to be replaced, but what role do baby teeth play? How important are they?
Absolutely. This is a question that we get all the time. When a parent comes in and their child has a lot of cavities, the first thing is, well, they're just baby teeth, they're going to fall out. But baby teeth really are essential. Though the back teeth, they sometimes don't fall out until the child is 11 or 12 years old. So that means that baby tooth has to hold that particular space until the new tooth can come in. So to maintain that space and to make sure that the tooth structure is there is very important, or else the child automatically has a crowding issue that they're going to have to deal with earlier. Also, if the baby teeth aren't healthy, the new teeth can be affected by any infection or damage done to the baby teeth. Oftentimes we see permanent teeth that come in with like a spot on them or damage due to an infection that had happened in the baby teeth. So keeping them clean, keeping them healthy, and filling any cavities that need to be fixed are extremely important. Aside from that, the front teeth are very important for speech, just for a child's confidence. It's a lot of things that are involved in these baby teeth starting at a very young age.
And then speaking of taking care of teeth at a young age, can you talk about toothpaste and what kind of toothpaste you should be using when they're babies and as they get older, and when fluoride gets introduced, and how often they should be brushing and flossing from babyhood to childhood?
Right. So a little tiny bit of fluoride toothpaste should be used when a baby gets their first tooth. And that's just a tiny smear on a little toothbrush. And that does not need to be wiped off. It would be brushed on the teeth, and then a child can swallow that. For a child to have an issue with the fluoride from the toothpaste, they'd have to swallow quite a lot of toothpaste. As they get older and they transition to having more teeth, then a little more toothpaste can be used, like a grain of rice is what we say on the toothbrush. And again, brush it on, leave it. They don't have to rinse, they don't have to spit it out. But just a tiny little bit of fluoride toothpaste really helps those teeth as they're erupting into the mouth. For parents that are against fluoride for whatever reason, a different type of toothpaste that people can use is something with a sweetener called xylitol. That also seems to help reduce caries rates in kids. So, you know, it can go either way, but as long as a parent is brushing and flossing when those teeth contact, and that's usually around 2 or 3, that's important. As long as they're getting all the bacteria and all the soft stuff off their teeth, then it would set them up for success in the future.
And in terms of success, what are your top tips for parents in terms of preventing tooth decay, whether it's habits? Also, I'm curious about foods that are trigger foods for cavities and foods that we should encourage our kids to eat.
Absolutely. So, like I said, starting to go to the dentist by age 1. If that's the case, the parent, when they come to the appointment, they really learn all the positives and negatives of coming to the dentist, of the food choices that they give their children. Some good food choices are yogurt, cheese, whole fruits and vegetables, not the gummy fruit snacks. Really staying away from any fruit juice. That's very important. Mostly water during the day. A lot of people seem to think that drinking milk all day is great, or Ensure, or some of these Pediasures. That's very, very high in sugars and high in carbohydrates, and kids get cavities very easy. As the child grows in our practice at around 6 years old, when they're getting permanent teeth, we do put sealants on their permanent molars. And that's a protective coating to help children not get cavities on the biting surface of their permanent teeth. So if the children are starting to come to the dentist at a young age, then we follow them every 6 months and give them and their parents recommendations for things that they could do better or change a little bit to improve the oral health of their child.
My kids got sealants, and I have to say it was the best thing we ever did for them. I mean, after that, I never saw any cavities. It was
It's a huge deal. It is.
Difference, especially because my daughter has a sweet tooth, so it really made a big difference.
Yes.
I would say my last question would be just in general, if there's anything we haven't covered for parents. I mean, they're looking to get as much learning from you as possible in terms of your top tips to keep their smiles looking great and healthy.
Yeah.
That we not have covered.
Well, you know, I've been getting a lot of questions, especially during this time, because the kids are home, they're bored. A lot of children are going to be schooled at home now as well. So reducing the amount of snacks that a child has during the day is very, very important. Right now, because they're home, they seem to be sitting and eating junk all day. And I can understand that, but that increases the chance that a child will get a cavity. But even though a child may be home for school or their patterns may be different, coming to the dentist, making sure they're brushing at least twice a day and flossing at night is very, very important. But if a parent is concerned about coming to the dentist or how their dentist is making things safe during this time, they should call them and talk to somebody at the front desk about what they're doing to keep their child safe, so then they could feel reassured that they're coming into a safe environment and that this is for the benefit of their child, not for not putting them in harm's way.
I need to heed your advice about snacking as well.
Yeah.
Like sitting all day, myself, my kids, it's hard to do, but we have to do it. Dr. Winokur, we're so grateful. We learned so much from you during our chat. And for anyone who's interested in learning more about the practice, it's in Lakewood, Jackson, Toms River, Howell, and Neptune. Go to dentistryforchildrenus.com, and the number is 833-KIDS-DFC. And we really appreciate your time, Dr. Winokur. Thank you so much.
Thank you so much.